It's important to get healthcare people and business people together because we need the management skills. And I think there's some evidence now that clinicians in leadership roles at hospital systems such as Cleveland Clinic or Mayo Clinic do a little better on the quality than systems that are not led by physicians or clinical people. And I think that having the clinical experience, the experience of taking care of patients, being one of the folks who knows what it's like to be in the trenches, really helps the leadership be effective and reminds us to address the issues of quality and of service a little differently. On the other hand, business folks actually have a little better sense probably of how to work in teams and how to make processes work and how to have a little broader perspective than we do. So these things have to come together and mesh in order to make this work.
Healthcare is a business. Healthcare consumes 1/6 of our economy, so it is a very important business. The difference is that healthcare is driven by ethics, by very important human needs, human emotions, and the consequences of the business decisions that we make in healthcare can sometimes be life or death.
So healthcare is defined by the government as a service. However, healthcare is also a business, and without that business background, or at least the fundamental understandings of how a business is ran, you will not be successful. You have to have that business aspect to keep your facility running and in good standing. So without that knowledge, you're not going to have a place to take care of your patient.
I've been asked, well, how does business engage in healthcare? So there are a few pieces to this that we have to think about. The underlying issues right now include the fact that we pay a lot for healthcare in this country, 50% more than the second most expensive country in the world. The question is, are we getting our money's worth out of it? And I think by any measure, the answer is probably no.
I have IT responsibilities, and I'm thinking that if I get it more into administrative roles, I'll need more some of the business and managerial training as well.
We have to reach a certain clientele. In order to do that, we have to grow as we would a business. So I am a board certified behavior analyst. I work for a local agency called Family Insight. We provide applied behavior analysis services in the home and community to families and children affected with autism spectrum disorder, intellectual disabilities, and other related disorders. We have tons of children that are needing services right now, and so if we don't know how to grow our business and how to market ourselves and how to reach those people, those children will never get those services.
Traditionally, Virginia's been probably a little lower cost than the median for health care. We have the same problems that others do. We have problems with uninsured, uncovered. We have the same illnesses that everybody else has. We have chronic diseases. We have issues associated with poverty like everyone else. We are like everyone else in trying to find the right solutions.
I hope that we could step back from the kabuki that is the current dance in Washington and get to some meaningful bipartisan discussions about where we're going to go, how we are going to intelligently and thoughtfully deploy the limited resources that we have to make the health of Americans better.